Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Charlie Nahabedian, CEO of BK Digital Health. Charlie has been instrumental in developing innovative telehealth solutions within the digital healthcare landscape. His work focuses on addressing the high costs of outpatient services by leveraging medical, healthcare, and technology expertise. With over 55 years of experience in the telecommunications industry, Charlie has applied his extensive knowledge to revolutionize healthcare technology. He has been at the forefront of developing advanced person-to-person communication systems, as evidenced by his work at Video Call, which won an international award for innovation in communication systems with funds transfer capabilities. He also holds 2 patents and received a national award for outstanding contributions in the field of science. His career has been marked by the development of groundbreaking technologies, including the first cordless telephone and interactive touchscreen kiosk for Disney's Epcot theme park. During this conversation, Charlie shares his extensive journey from electrical engineering to digital health and discusses the integration of telecom experience into digital health solutions, the challenges of finding and maintaining talent, and the pros and cons of bootstrapping versus seeking funding, while emphasizing the importance of addressing healthcare costs and access. Charlie also reflects on his personal mission and the potential of AI in transforming the healthcare landscape. Drawing from his experiences at Bell Labs and Disney, he highlights the importance of understanding human factors in technology design and addresses the challenges facing digital health, stressing the need for open communication among team members and a focus on patient-centric solutions. He expresses excitement for future innovations in healthcare detection and emphasizes the importance of understanding the digital health landscape to leverage advancements effectively. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we're bringing you face-to-face with the industry-leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty of building and scaling healthcare companies, the hurdles they've overcome, and the strategies that led to their success. More importantly, we dive into the personal challenges that come with trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or someone just passionate about the future of healthcare, this podcast is your backstage pass to the minds shaping the industry. The K in Clarity podcast is proudly supported by Kimura, a growth partner firm that works with digital health, telehealth, and healthcare tech companies to overcome growth and operational challenges and drive changes in the U.S. healthcare system. If you're running a digital health company and facing growth challenges, check out Kimura.co. They might just be the partner you need to take your impact to the next level. Now let's have Charlie tell us a little bit about themselves. Welcome, Charlie. We're really excited to have this conversation with you. I know that you've had a breadth of experience within digital health, and I'm really excited to speak more about it. For the people listening, can you give a little brief overview of who you are and what you do as well?
Sure. Charlie Nahabedian. I started life off as an electrical engineer and decided to go as far as I could with that. And got my master's until Uncle Sam decided he didn't want me to go any further, and I went on active duty for 2 years. And the good news was I got a very interesting assignment at Fort Monmouth in the electronic warfare lab when I got back from overseas, and I got my first job at Bell Labs right up the road from where I was living. Doing the work I wanted to do, which was mobile telephone communications. And that set the stage for a very enriching career that added to my technical knowledge and gave me an opportunity to develop my business interests, which after 40 plus years of experience, I was able to focus on healthcare and say, wow, my experiences from all these different things in life could come together to solve a problem in healthcare better than anyone is even trying. And that's kind of what got me here. And I literally came out of retirement to continue this project because I didn't see where anyone else was going to get it done the way things were going. And I had a dedicated team to do it.
I love that. I love the years of experience. I think that's something that we're going to touch upon. But I always like to do a little bit of an icebreaker to kind of start off our conversation. So if you had to combine any two, groundbreaking healthcare innovations together to create something to help assist and bring about change, what would they exactly be and why?
Well, let me ask you to rephrase that.
Okay.
Just a little bit.
I think with healthcare, there's a lot of focus on innovation and bringing about change. So what can be done exactly to combine any groundbreaking new tools, new advancements, innovation to actually bring about the type of change that people want to see within the U.S. healthcare system?
Let me tackle answer a little bit differently than maybe you were expecting.
Okay.
The key thing about healthcare that people have been complaining about for years, literally years, is the high expense of healthcare and the fact that there was not equality in obtaining healthcare. And I saw that firsthand when I was managing a senior living facility for 8 years. And we literally had to have 2 vehicles and, a good half a dozen people we could rely on as drivers on a part-time basis to basically take them to their medical appointments because they didn't drive. And that was in a reasonably moderate neighborhood, but these were low-income individuals, and they were in subsidized housing. But even then, I see it today in upscale senior living facilities that people get to a point where they can't drive or are smart enough to realize they shouldn't drive, and they need a ride to a medical facility. And sometimes it's for a minor situation. And there have been Harris polls that show people are reluctant to go to a doctor because of time, distance, or cost. So if they forego what could be a critical visit that would give the doctor a heads up that there could be a more serious issue coming up, they miss that early opportunity. And there are medical studies which show that when people get regular care when they need it, they end up in better health and have better longevity. So let me just go back a moment to the economics. I can go more deeply into this, but at one point there was a study that showed that about 40% of healthcare costs in the nation were attributable to doctors' visits as a general category. And so you say, well, that's a pretty big chunk, all right? The rest is in-hospital, visits or surgeries or whatever. But this 40% is low acuity, generally speaking. And it's seasonal illnesses. It's the monitoring regularly of chronic illnesses. It includes dental, by the way, which I'm not touching yet.
Yeah.
But so if you could attack that economics and provide more frequent, regular care to seniors or the general population that's underserved in rural areas and some suburban areas, it's a win-win. So, I looked at that and said, I can take care of at least all of the serving of remote locations using Telecom, and I can take care of part of the health costs by improving access and improving general health. And then when we got into the microeconomics, we realized we had to do that a certain way to really reduce costs. So I think it's exciting that existing technologies with a little bit of new technology can be combined in a way to accomplish that. And it was nice that I was able to put a cross-discipline group together to help bring focus to that.
Gotcha. I know we had kind of discussed as well about your telecom experience. How did your telecom experience, I think, bring about the changes that you kind of wanted to see in digital health?
Yeah, my wireless experience, let me say it a little bit more broadly, was important from several perspectives. Number one, I understood the economics of using one kind of wireless technology versus another. Satellite, cellular, Wi-Fi, and I realized also that there were improvements in each one of those areas. over time. So it wasn't a static situation, and you had to understand how they compared when you're ready to launch and what you could do with that versatility. I had another experience mid-career where I was part of a company that was serving taxi fleets and trucking companies. And I learned that transmitting data over wireless is a non-trivial item. And so we had to take some of the lessons learned there if we wanted to use wireless in the digital health solutions. And we are. But probably the one experience that has helped us survive, I'll use that term loosely, to this point on a bootstrap basis, is that the lessons I learned in my first startup to develop a portable cellular telephone. That was the company I sold to LG that got them started in the cellular business for a good 25 years. And their first phone was developed by my team. And that was, we focused on what the market need was for a particular kind of product. And yes, there could be all sorts of bells and whistles. But you shouldn't get enamored with all those bells and whistles unless they're either essential in the product or you can get it next to nothing as you design the rest of your product. And we hired people on that team so that, I started from scratch on day one with me and my secretary, and they were called secretaries back then. But 10 months later, I had 20 employees.
Wow.
And a working model of a brand new design cellular telephone. Unheard of. My company I just left, the Big Bell System, took them 4 years to develop their most recent wireless product. Yes, I had a few tricks up my sleeve. I hired some excellent people, but focus on what the product should be and a focus on the skills we needed to get to a working product were important. And we've applied some of that here in this company. I've got a core of about 4 dedicated people, and I've got a team that I can pull on an as-needed basis. I think we've probably drawn up to about 14, 15 people. When we get fully funded, and we think we're getting closer to that point, some of those people will be hired on a full-time basis, and then we'll move forward much more quickly.
I think you spoke about a little what drew you to the digital health space. Could you also touch on what digital health leaders should know about, finding the best talent? Because it can be very hard, especially finding people that are very domain specific within healthcare. So how can you go about finding some of the best talent who actually want to take upon the challenges, the complexities within the industry?
That's a good question. I'd say you need to know all of the technologies and product needs well enough to know whether someone might be suited to contribute or not. And then when you get into the technologies, is their expertise really relevant, or is it obscure and they've got to learn anew, which could be a challenge. But I'd say that getting those right people and keeping them coordinated and focused is key to keeping the project on track and making the best progress you can with the resources you have available. Digital health is quite a broad service area, product area.
Correct.
And so you can hire someone who claims they're an expert in digital health. It may have very little relevance to what you're working on. So you really have to dig down and understand how relevant their experience really is. And I'm doing that today with strategic partners. There are a lot of companies that want to sell to you, but in time I might use some of those products or services that they offer. But in selecting a strategic partner, you want someone who's got some synergy with what you're doing, but complements what our company is doing in a significant way. And so I'll just say a folio of potential partners and potential strategic partners. And at the right time, then I draw them in to see how we can make progress together.
Okay. I think with what you'd mentioned, I guess, how can digital health companies really find the right strategic partners to be able to employ? Can you speak upon that a little bit more?
Yeah, that requires more and more knowledge of the customer. It's very easy to, zero in and say a doctor's office is what I see when I walk in the door. It's a lot more. Or the hospital is a lot, when I walk into the ER or I walk in for a scheduled whatever, that it's more than that. And they are. They've all adopted certain levels of technology, and then you have to determine how does any of what you have fit in. How does it interface, if appropriate? How is it supported? And it takes a lot of knowledge of the customer, both on the provider side and, for that matter, the patient side, to do the best you can. As far as where do you find these people? These days I use LinkedIn an awful lot, and I look for referrals. I needed an excellent marketing person. I got an excellent referral, and she helped us in the rebranding and the messaging and most of our collaterals because of her expertise. So referrals are always the best way to get good people. And that's one of the reasons I was successful with my first startup. I had about half of the people that I hired were referrals who had relevant experience in the areas that I wanted, and they could hit the ground running.
With what you'd mentioned, how can somebody that was drawn in, like you were, right, what can draw other leaders to want to innovate within this space?
I think healthcare is a large, complex arena. And I think there's room for many players. And if they understand there's a niche where they can make a contribution and they can bring the knowledge, talent, skills together to do that, I'd say, go for it. I'd also say that it's important to try to understand, much as I just touched on with hospitals, to understand whether your solution is a standalone, one of a kind. It cures everybody that has high blood pressure, but doesn't do anything else. But I'm not saying that's bad. I'm saying, yeah, that's great, but how does that fit in with all the other ways that we need to serve patients? And is there a tie-in? It has to tie in someplace. It can tie in the doctor's head if they've got two separate systems to play with. Or it could be integrated downstream, so that the doctor has a more uniform and complete presentation. So we've looked at new devices that have either recently been FDA approved or maybe FDA approved. And when they are, how would we incorporate them? Do we have the architecture that would accommodate innovation in the patient unit, innovation within the network, or innovation within the centralized portion of the system, some of which may be in the medical provider's facility? So and when you can do that, you've got a more complete solution for both patient and medical provider.
Gotcha. A lot of the things that, people focus on as well is how can you integrate, right, a lot of the, systems that apply within digital health into the provider and what they're trying to do with their care, right? Because you don't really want to interrupt their workflow, right? Mm-hmm. But hey, you still want to disrupt innovation. So what have you learned from, your years of experience, and what would be the advice that you could give in really integrating that delivery or solution into a provider system?
Well, I may reiterate some of what I said, but you look at very closely where and how is the best place to integrate your solution for the benefit of the doctor primarily, but maybe also for the patient.
And when it comes down to as well the things that you have focused on and bootstrapping, it took years of experience as well to help bootstrap. What would be some advice that you have for founders, leaders that are trying to actually work and provide these solutions as well in bootstrapping?
Well, I'm not a great fan of bootstrapping.
Okay.
You do it when you have to. We had hoped to get funded much earlier based on the vision and the concept. It didn't happen. But then when we got to a prototype, we had a major multi-million-dollar commitment term sheet, which would have probably been about the limit of what I would tolerate in bootstrapping, which was at that point about 5 years. And we went through due diligence and something called the pandemic came along, and it wiped out that opportunity. And within the time of the pandemic, investment by and large shrunk. It wasn't as readily available. And we didn't want to fold the company up because we saw still too much potential benefit in what we were doing. So we had a cabin concept, and that was a working prototype. It still exists up in Baltimore. But we decided during the pandemic that based on all we learned in putting that prototype together, we could pull the chair out and make that a separate product, a standalone product. It'd have a different application in terms of environmentally where it would go, but there were places where that chair by itself could be a solution. The very obvious one, tying into some of our previous discussion, is that we could put that into a truck or a Sprinter van that you or I could drive and park it. It connects by satellite just like a roving TV camera crew. Patient walks in, sits down, has a complete examination, just as if they walked in the doctor's office or a CVS mini clinic. So, and we could get that ready for a lot less money. And so that is what we did. We raised enough money to get it to what we call an MVP, minimal viable product. Mm-hmm. We demonstrated it. We videotaped it, not taped, but videoed it. And that has attracted a lot of attention. And we're now, basically utilizing that in our discussions with potential strategic partners and potential investors.
You mentioned that you're not really a fan of bootstrapping, but could you explain a little bit more about why you're not a fan? And additionally, any tips that you probably have for, people that want to provide, digital health solutions, any tips that you'd have for them?
Yeah, bootstrapping, for those that don't understand it, is basically the team is working for primarily equity. The monies raised are used to provide products, pay contractors or contract services that will not take equity. And so now for 10 years, I've been working nearly full-time, with some exception, and not receiving any salary. Very difficult to put food on the table under those circumstances for some people. And yet, I've been part of the investor group also, and many founders are part of the investment group. So here you're working 10 years and someone says, well, you're still too risky to invest for me. Well, I guess I'm either believing my own vision, which I should, but I'm a glutton for punishment. It's much nicer when you have an investor who backs you, and now everyone working is tied into the company through employment contracts and employee stock options or whatever. So you have a committed, dedicated team that makes this the number one attraction so you can move the project along as quickly as possible. So all of my experiences and with prior projects, most of them have been funded up front, and I basically got them done in 18 months. The one exception was the team I put together at Bell Labs. It was a $30 million development. It took us 4 years. We had something like 5 development groups working on it. Each group had between 4 and 8 engineers, some with PhDs. Yet, by Bell Labs, it was a model development, because we took it from concept with the first use of the microprocessor in a telephone system. We got it through manufacturing with a quality manufacturer, and we got it in a field trial, which was well received. Not only well received in the field trial, but it was a product in the product line of AT&T companies for 10 years. So it was, well-designed product, met a very important need, and had good features, functions, and reliability. And I got 2 of my patents there. So at some point, you're much better off with a dedicated team than bootstrapping.
Gotcha. You mentioned the vision, the mission that it takes to survive the punishment, as you'd mentioned. How do you tie what your personal mission is? And if you could tell us a little bit more about that and how what you've been doing at, VK and just generally in your life and your career for others to learn.
Yeah. My personal philosophy, you could say I got from my dad. He was a genocide survivor. He came to this country at age 18 with the equivalent of a sixth grade education and raised a family of 8 kids. And stated goal in life was that his children would have better opportunities than he did. And we all did. We all went to a good school system and we all did the best we could. But in any event, it also gave me lessons on how difficult it was to get health care. We lived in a suburban city outside of Boston, and the family doctor happened to be in the next town, roughly 20 minutes to a half hour ride away. So every time one of us got sick, he had to close his tailoring and dry cleaning store and drive us to see the doctor, all 8 kids, whatever, because my mother didn't drive. So, I said, this is kind of nuts, even as a kid, that, we had to go so far just to get attention. Well, clearly he had a family doctor he trusted. By coincidence, actually better than that. It was not coincidence. The doctor also happened to be his uncle and his sponsor for coming into this country. At 18 months, my dad took me to the doctor and said, this kid's crying a lot. I think he has a stomach ache or whatever. And the doctor examined me and said, no, he's got appendicitis. He needs to go to the hospital. My dad drove another 10 to 15 minutes down the road to the nearest hospital and got turned away. That happened twice more. On the third trip, my dad was rather incensed, and he basically said, well, if this kid dies, one of you doctors are going to join him.
Wow.
And they took him seriously, and they operated. And I had an appendix that was about ready to rupture. At 18 months, I can't tell you the dozens, if not hundreds of times I've heard this story. But each time you hear it, you put it in the context of what you know when you hear it that day. And I'm saying, why did he have to drive so far? Why was it not obvious to the doctors at the hospital? Why did he have to go scrounging to get blood donations? Because I needed some transfusions. And thank God he was successful. And the doctors were successful in the end. So I am very, committed to trying to bring better health care. Now, yes, things have improved tremendously in those 80 plus years since that incident. But human nature is still out there. It, by and large, doesn't change. So we got to give humans whatever role they play in society better information so they can make better and quicker decisions. And even today, in today's healthcare, there's room for that. In digital health, in all its forms, coming together the right way can help accomplish that. And that's good for everybody.
In my personal thoughts, right, everybody wants to make change, but there's some really big challenges, and who's going to play a part? Is really going to be a business leader? Going to be a policymaker? Is it that's in the provider? How can people really affect or work together in that way to really align incentives as well?
Let me zero in on a topic we all hear about these days, try to understand and put it in perspective as to whether it's good or bad. And that's something called AI, artificial intelligence. Now, the fact of the matter is AI in one form or another, probably its simplest form, was available back in the late 70s. And it in itself as a technology has obviously improved. So we have a form available now called generative AI. And that's got some great potential in digital healthcare, because there are things that need to be analyzed, which we've been doing for years. We've applied intelligence to those analytics, and that has improved things. But none of us are going to consume quickly a bunch of tables and charts for the benefit of the patient. So I think AI is one area where we can apply computer technology and do a good job on understanding and assessing the patient more completely, making the patient aware of what that is in simple terms, which generative AI could help do. But it could also better inform the examining clinician, whether it's a doctor or nurse practitioner, that here's the data and here are some likely conclusions and here's some maybe not so likely conclusions. And that's, might be places where you want to initially focus to try to apply your medical knowledge to diagnosing this patient more quickly, completely. And it could go so far as to say, here are the medicines that you could consider using for that patient. Here are the ones you ought not to because of interactions or prior allergic conditions or prior knowledge of the patient where they shouldn't be on that kind of a drug. There's some room for huge improvement in that space, and some of those areas are where we're going to incorporate in what we're doing, but we're not going to hit all those areas. There are companies out there that are focused just on improving the knowledge and treatment of cardiac patients in much more detail than we are. Well, there might be a way of incorporating, if not the tool, at least the resulting data into that patient's chart, which we would help put together for the clinician. So I think I would encourage a lot of innovation in digital health area, and I would encourage them to get medical advisors or inventors on the team, and I would encourage hospital systems in particular, perhaps medical practices secondarily, to be more open to trying new technologies and validate them or critique them, or both, so that we can make progress. There are some people in the medical field that just they're happy with what they have. They don't want anything to change. And that's good and bad. But it's definitely bad when you're trying to improve the healthcare system with what we hope is better technologies.
How do you think these companies that are providing solutions can better speak to people to help them to provide the change? As you mentioned, sometimes a lot of people are stubborn, and it's something I've heard as well, that, hey, we try to implement this, we try to provide data or insights, but it's hard. One thing I've heard potentially is pilots. Programs might work, but I'm not sure if there's any other things that you've seen in your experience that you think is better to speak to these people.
I think pilots are excellent. I think the approach we're taking ahead of pilots are medical validation tests, where we get a group of doctors and patients to try it in a semi-laboratory situation, much like we used to do human factors testing at Bell Labs, where we designed the telephone. Then the question was, are the buttons arranged well? Are they, easy to use? Are the features and functions of the telephone system easy to use? We expect to get those kinds of tests and validation and critique done, and then use that as a way of perhaps making some improvements or better knowing how to approach a pilot situation where doctors are actually using it for patients who are ill and are getting diagnosed and treated. So kind of have that as two separate sequential situations.
You mentioned that your experience at Bell Labs was something that seemed prominent for you in your early career. Is there any other experiences that you had during your career and during your time that you feel have made a great impact today as well, and while you're implementing digital transformations for patients?
Yeah, just let's say jumping off from that human factors testing we did at Bell Labs, it was important for us in design of that telephone system at the time to understand what it was that the telephone user wanted to do. Did they want to call within a building? Did they want to call outside a building? And is it easy for them to use buttons to efficiently accomplish that? So you think about that for a moment and the testing to validate that that's a good approach that we took. And you say, well, is there another experience? Yeah, the experience I had later on, perhaps a half a dozen or so years later, was when I was the architect and program director for what was called the World Key Information Network at Walt Disney's Epcot. Epcot was the acronym for Experimental Prototype Community of Tomorrow, and it had all of these futuristic pavilions where people could learn about what might happen in the future. And they wanted kiosks around the park that park guests could go and touch the screen without any human education or interaction. And the park guests could learn about the park, the pavilions, the restaurants, the restaurant menu and pricing, and they basically only had to touch the screen in any of 4 languages, English, French, Spanish, and Italian. And when they exhausted the database, which included video presentations and previews and pictures with alphanumeric overwrite, if they still had a question, they could touch another little spot on the screen and have a face-to-face call with a live attendant, just like you and I are having. This was designed and opening day was October 22nd, 1982, before PCs made a break in the market, long before cell phones. Okay? And the approach we took was it had to be easy for the park guests to approach. The selection had to be easy. They had to use a touch screen. Touch screens were barely on the market. The ones that were not reliable. My team picked the most reliable touchscreen technology on the market and then had some software engineers at Bell Labs help them make it more reliable so we could use it.
Wow.
The Bell system, the way I renegotiated the contract, ended up with all proprietary rights to new technology. They ended up with 3 or 4 patents. They spun off 2 new companies based on those new technologies. And Disney had 43 terminals connected by 5 miles of fiber optic cable, controlled by 2 mini computers, accessing 13 video disc players, half a dozen live attendants to answer calls. Already on October 22nd. And my daughters were about 9 and 12, and the 18 key families in the Bell system that made that happen, including mine, got front row seats for the opening ceremonies at Epcot. Nice. It was like front row at a Broadway show. It was absolutely wonderful. But the lessons learned there about understanding human interaction with a terminal and how to make it easily understood and functional, those principles still exist today. They exist when we use a webcast or a Zoom or some other kind of audio video link up. It has to be, people have to see what they want to find quickly for the functions they're going to perform, and there can't be very many what we call hang-ups or problems.
Yeah. Something you had mentioned as well early in the conversation is that you're a sucker for suffering a little bit. I think one thing that a lot of people would like to understand is, something that you've gone through with challenges, especially at VK. What are some challenges that you faced that you believe has made you more perseverant, and that you could probably have others learn from that they may be able to take away?
Wow, that's quite a question. There have been times that either I or my partners in crime, challenged, do we develop this little widget or improvement to make the product a little bit better or what? And it's important that the team players try to retain as an open mind as possible. And even if you have some doubts, don't be afraid to express them, but also express what you see are the benefits. Because the true solution comes out of everybody stating what they see are the benefits and what they see as the difficulties or issues in pursuing that path. And the best solution is due to that interaction and a little bit of, yes, the benefit is worth what we're going to have to incur in the way of cost or time or deliberation or whatever. And it's important that when people reinforce the vision that they want to accomplish, you can take these suggestions and say, may not be obvious today, but let's give it a week to pursue the concerns or issues or problems with this path, and let's revisit it. And again, people keeping an open mind. I've changed my mind on several things, and my partners have done the same, and we laugh about it sometimes.
I think with what you said there, a way to bring about change and really focus on what they want is focusing on, the patient, the person that's going to be receiving the care. Is that something as well that you focus on as kind of your North Star for innovation? But is there any other things that besides that help you prop that up as well?
Well, the patient side, we understood pretty well because one of our medical advisors and shareholders was chief medical officer for mini clinics out in the marketplace, which our chair and or cabin replicate in terms of the services we provide. And so that part we understood well, and we were able to reinforce where we needed to. The part that we continued to focus on is the medical provider, because they tend to be the more reluctant participant, and it's not clear when they're under financial pressures that many of them are under, that they should spend time and money on something that might have 2 customers a day or someday 200 customers a day. And really, what does that do to their particular economic situation? And we've done our best to understand that environment and present to them facts and figures. And we think we're starting to see some flexibility there. Yes, it's important to engage with them because even in a simple concept that we describe, a patient unit, telecommunications, and a provider unit, everybody comes in with preconceived notions or biases. Satellite's too expensive. Well, if you use it the wrong way, obviously it's very expensive. But if you know how to use it economically, it's not that expensive. And so you can take each element, and someone may have a problem with one aspect or another. Just got a comment from a reviewer that said, who's going to pay for all these computers in the provider's location? Well, obviously, they either have the computer already, because we'll give them a software package, and it's just another application on their existing computer, or if they want a dedicated computer, yes, they're going to have to spend a couple $1,000s for a computer. But do they have to buy 50 of them all at once? No. They can buy as many as they need for the units that they're supporting, and then they can build as economics make sense and performance makes sense. In other words, what are their delivery standards? As soon as the patient says, I'm here, I want to see a doctor, do they have to wait 30 seconds, which is the best we'll do, or because they don't have a doctor or a clinician available, the patient has to sit there 15, 20 minutes. That's the medical provider's got to make those decisions. Is that the greatest service they want to offer the public?
That's a great point, because the doctor is involved in everything, so you have to focus on them. What have you seen successful from your experience speaking to providers and speaking even to the admin that are involved within that system or practice that's providing the care? What have you seen be most successful?
What's most successful is when doctors realize that the services they provide to people out in remote areas is sort of like, I'll call it a 911 call. I don't mean in the sense that it's a tragic situation, but people who would use our remote terminals, our remote clinics, are doing so because of convenience of access. They didn't want to spend the 15, 20 minutes or an hour traveling to a doctor, or wait 2 weeks in some cases to get an appointment. So you either meet the patient where they want, and then you price the services accordingly. We've designed it so the cost of delivery is less than the cost of delivery of walking into a mini clinic. But that leaves a wide margin if the doctors want to charge what the mini clinics charge, or they want to add another $10 because of the convenience, which some people will pay 10% for convenience. So the medical providers have to determine how are they going to market and implement this service for what could be and should be. And some of them don't have the time for that, and some don't understand the economics of it.
Would you say that maybe the strategy changes in places that are not as remote and rural, maybe more closer to the city and maybe a greater metropolitan area, or not really?
There is a different strategy. You could apply different economic parameters for suburban than you do for rural, because generally speaking, suburban clients have a higher level of income than the rural and remote citizens. So, and there are ways of even reducing the cost of delivery for those rural and remote patients through government and state grants and corporate sponsorships, okay, which subject in itself. But the urban areas, my dad had a store at one time in Manhattan. He said he made the best money in his life there. I said, in Manhattan, Dad? He said, the population density is so high, you only have to capture a fraction of that population who live in close proximity to your location to make money. Well, the same may be true. And let's take Manhattan. There are, tons of blocks in Manhattan, top to bottom. Many of the workers in downtown Manhattan either live uptown or in Connecticut or New Jersey. And for them to go and see their doctor if they're not feeling well all of a sudden, why shouldn't they be able to go no more than a block away, or maybe even in their own building if it's a large multi-story building? And so you could price that quite differently. But then you also have, in an urban area, some blight areas, right? They may be high crime areas. There may be places where a Walgreens or a Target closed. All of a sudden, there are no services left. The doctors have left. Well, there are still bodegos, barbershops, grocery marts. You could put one of our clinics in one of those. And you could price that lower because in all likelihood, people who live in blight areas are not making as much money as the ones working on Wall Street. So, and you can then franchise those. Think about that. You could, through a government program, provide the equivalent of an SBIR or SBA loan. You would have had to prove the economic model to meet all the franchise laws. And I could pick any decent, aggressive entrepreneur who lives in that area and say, you're responsible for the marketing, the security, the support for that equipment so that it's always ready for the next patient. And you're going to get a piece of the action. And now I'm doing economic development at the same time. So I think I've answered your question in a little bit more. I'm more than a technologist at this point in my life. I want to not only improve society, but improve all elements. And I think that's very important that we all do what we can in those arenas.
Is there any innovations as well besides technological ones, as you've mentioned, that in the next 5 years that has you excited, that you're interested to see?
Yeah, I think I see a lot of excitement in better detection techniques, technologies that can more quickly assess a patient's condition as part of a diagnosis. There are companies doing research out there where they can do a patch on your skin and it can determine certain aspects of your health. Those results of that, if they can be processed quickly, could be fed into your patient records and perhaps even be part of your examination. Some of those techniques, technologies gather data and send it up to the cloud for processing. But that doesn't mean that it can't be sent back down to be part of your patient record during that examination. And that would give the doctor or clinician examining you more information. It might even give our AI technology a little bit more information to process, and it would be, provide better input to the clinician. So, I think anything that does a better job of early detection or better understanding of your medical condition would be a phenomenal improvement. Just as a side note, to punctuate what I just said, I'm a 2-time cancer survivor.
Wow. Congrats.
And the only reason I'm here today is, number one, in both cases, a very early detection. And in another one of those cases, much better detection and treatment than existed 5 years earlier. The doctor said to me, Charlie, had you walked in this office 5 years ago with this diagnosis, I would have given you 3 years to live. For all of the so-called criticism of our healthcare system, when you look at progress in the areas of diabetes, cancer, cardiac issues, in those individual areas, I could go on and name others, the healthcare system's done a phenomenal job of advancement. The challenge for digital health entrepreneurs is how do we leverage off of that advancement and provide a better picture of a patient's health when they have a problem and the clinician is examining them.
Charlie, I know another thing that you'd mentioned before we go into our lightning round. Depth of experience is very profound. But I think something that we had spoke about even before this conversation is that you said to me that there's some things that you understand better that enable you a little bit more to provide, innovation within healthcare than others. What is that thing, would you say, that you really understand and maybe that you would like to pass along to others for their own understanding as well?
Well, I gotta stop and think about, when I said that and under what was in my head at the time. Digital health is a broad field, and you can understand that better if you not only have knowledge in the device area as to how that device interacts with a human being, but also how and best to share that information with a clinician. And when you look at it that simplistically, it's like two tin cans with a string in the middle. It looks that simple. But when you start to look at a patient's record, or all the measurements that might have been done on that patient in the last 3 months, including not only a physical exam, but perhaps some blood analysis, urine analysis, ultrasound scans, whatever. There's a pretty big picture, pretty big size of data on that patient. And every one of those pieces are important for one reason or another. It either lends credence to why a doctor might take one approach or another, but it also basically says, I don't have to worry about this aspect of this patient because they're in great health. Let me focus on other parts where they're more likely to have a weakness. And so I've had some experiences where I looked at large databases and looked at how can you analyze those databases to extract useful information, and what's the best way to present that. And I almost launched a company in a field called data visualization, and you take a multivariant data set and you can simplify some patterns within that very simply and easy for the human observer to see. And then I've had other database experiences where I pulled worldwide databases together into a data warehouse and had to not only deal with the anomalies, but also how can you access that data to make it useful and what conclusions can you draw. So I think part of what I bring to the table here is the ability to think microscopically where I have to at the biological, medical, diagnostic area, the human interaction on either end, the immense amount of data on any one patient or an aggregate of a population, and determine how do we make some sense out of all. And I'm fortunate that I've had that variety of experiences that I can bring to the table at this stage of this company. Once we get this company up and funded, you can then parse assignments, delegate, and make sure those parties, seemingly disparate parties, can communicate and have the same focus that I have right now.
Wonderful. Wonderful. Now on to the lightning round. So I have two special questions for you. Okay. And if you could give us your response on them. What do you think is the biggest myth in digital health?
The biggest myth in digital health is that just because something is digital, it's a good solution. It's like AI. Just because you have AI doesn't mean it's a good solution. Digital health is a form of technology. And so how that technology fits in with everything we've talked about and provides the useful outcomes that we've talked about is more important than, let's say digital health. I recall when I was a professor and, the next technology was the internet and web pages and online transactions. And people were basically promising great possibilities for the Amazons of the world. And the brick and mortar stores were predicted to go out of business. So goodbye Walmart, goodbye Macy's, etc. The point that I made then was the internet is a technology. How you use it to better serve the customer and support your business is more important. Well, Amazon did a phenomenal job. I'm not saying they're without fault, but they started off selling books online, and then they increased their product line. They brought in some of their own products, which caused a few issues, but then they drew on other sources of suppliers. They got into secondary markets, which was unheard of, where they were selling used items. And then they linked up with Whole Foods and set up their own brick and mortar. Each time they did that, it was a further extension of better serving their customer. And that's why they've been successful. It's not the only reasons, but that's a good part of it. The Macy's of the world struggled at first. They finally learned that they should capitalize on their brick and mortar because that was their bread and butter, but they ought to develop some online presence, and they have, and that saved them.
Perfect. Now, going into my next question as well for you, Charlie, is what's some of the best advice that you've received in your years of experience as well?
Best advice that I received is to keep an open mind on various topics, to identify clearly what you're trying to accomplish, and identify how you can be instrumental in making the team effective in accomplishing those goals and objectives. I feel very strongly, and I've preached it, I've taught it, that everybody should develop leadership skills, not necessarily with the intent of being the leader or the dictator, which would be even worse, but to understand that leaders have a role and they should influence those leaders. And if you are the leader, know the principles that make your team more effective. So my advice and what I taught many of my students is how to understand leadership principles, how to understand leadership skills and techniques that makes most people leaders pretty quickly.
Perfect. Well, Charlie, that is where it stops. Thank you for your time, for your insights. I hope I did justice to your years of experience and that we were able to touch on the little things to help, experienced leaders in the field and as well as beginners that want to join and actually make an impact in digital health. Is there any final thoughts that you have for the audience and some things that you want to leave them with?
Yeah, I think the one last thing I'd like to leave for those in the digital health space is that as you look at where your invention or inventions might make the best use, one perspective is where there could be the greatest benefit, but the other perspective is where you have the most receptive audience. And I would, with due caution and with adequate financing, I would encourage them to look at opportunities outside of the United States also. In particular, there's great need in Latin America, Africa, Asia, and the Middle East. And I only relatively recently learned that there's a big push in Africa for healthcare access out to the countryside. And that's being supported by a multi-nation group, and it's getting financing from Europe and some from the United States. So there may be opportunities beyond the U.S. shores that might help you establish your product and service, validate it, and then come back into the States with that validation. So while I don't encourage you to step out of the United States unprepared, I do say that if that is a better opportunity, you ought to assess if it's a better path to marketplace acceptance.
Gotcha. Thank you for the advice, some insight there. Where can the audience connect with you or follow you if they do choose to do so?
I welcome anyone who has relevant discussion to meet me on LinkedIn. And if it's business focused, contact me on my email address, which is my first initial C, my last name Nahabedian at vkdigitalhealth.com.
Perfect.
And glad to respond.
Perfect.
And tell them that Mezue referred you. That'll get my attention.
I love that. Thank you again, Charlie. It's been a fun time having this conversation with you. And this is another episode for the K in Clarity podcast.
Great. Take care.